You have 3 minutes.
Thank you. I'm Dr. David Kennedy. I'm a past president of the International Academy of Oral Medicine Toxicology, and mercury doesn't bother the Kennedys. My grandfather lived to be 93 years old, and he graduated from the University of Pennsylvania in 1875, and no, 1895, and my father graduated in 1938. Mercury doesn't bother Kennedys, and that doesn't make it right to put it in people that you saw here talk today. It also doesn't make it right for the dental students who are taught that mercury is safe to argue their patients into having mercury. That's what we were taught in dental school. We got a perfect discussion yesterday about how we don't use the mercury word. Oh, we call it amalgam. That's part of the deception. So that people don't understand you're implanting them with a time-release implant that will accumulate in various organs. Whether we can prove it's above the reference dose or below the reference dose doesn't make any difference. The reference dose is the ceiling above which we don't want to go. What happens if your mercury dose is down here? That's a good thing, not a bad thing. On YouTube, you can watch safer amalgam removal. The American Dental Association protocols were used in 1990, and they showed a huge spike when this committee voted to reject the white paper in 2006. Rodway Mackert was quoted in the Wall Street Journal saying it's unsafe to remove amalgam. Well, gee golly, how come it's so safe to put it in and it's dangerous to take it out? I don't understand. Doesn't that kind of ring like maybe there's some falsehood going on here? I say there's a lot of falsehood going on here. You can remove these things safely if you follow the occupational health and safety engineering controls and work practices. We went to OSHA in California and said, we need masks, vacuums, protection. And they came back and said, all of that is required by the law. No dental school in the United States follows these protocols. And it is the law. Not for schools, but for every practicing dentist in the United States. It is the law. Why aren't dentists not following the law? They're taught criminally by their dental school because it is accredited by a trade association that has a vested interest in this material. That's inappropriate. And that if you really believe in the professional ethics that we've all signed on to, you will follow protocols required by law that stop that blood spike of mercury that was proven in the scientific literature by the Frickholm experiments in 1957 with radioactive mercury. That can be prevented. That should be prevented. Please, God, insist upon the dentist following reasonable protocols. Thank you.
I would like to remind people if we can keep the decibel level of the talk so it's comfortable for people to listen to you, we can listen better and more completely. I'd just like to remind you of that.